Hello to all, I am Vishnu. In this video is actually going to be an extension of my previous video. You can check it on LinkedIn, my profile. In that I have mentioned about how you can study cases practically when you go to the hospital, how you can perform your hospital duties even if you are not getting proper motivation. Maybe your department is not teaching you properly, or maybe you are not able to join the doctor's rounds, or maybe everything is going like a formality documentation process, but you're not learning anything in the process. So how can you self motivate yourself and how you can study? That thing I've already mentioned there. You can check it out. I will say it in a summary. So basically, whenever you go to the hospital, even see, this is applicable to a student, this is applicable to an intern, this is applicable to a professional. And even if you are an assistant professor or a faculty, and if you are entrusted with clerkship duties or hospital duties in the college that you are working in, for you also this is applicable. If you are going to the hospital and if you are taking a case, you can study it two ways. The first way is the pharmacology method. So pharmacology method means what? Like for example, you note down all the medications that you have seen in the OPD or the IPD settings on a particular day. Like for example, there are certain departmental postings in which you are having OPD duties. Like for example, in dermatology we see that, in psychiatry we see that. So in that condition, you have to sit opposite to the doctor, patients will come, the doctor will give medications, the doctor may ask you some questions or maybe give you a presentation or something. So what you can do is you can note down all the medications that the doctor is writing. If you are in the IPD settings, that means you are directly going to the IPD, like for example, cardio department or maybe in the ICU or general medicine, whatever it is. Just note down all the medicines that you saw on a particular day, just the name of the medicine. Okay. Once you note it down, when you go back to your home, when you go back to your residential area, wherever you stay, just try to find out the pharmacological actions of this medicine. If you are able to find out the pharmacological actions of this medicine, let me tell you one thing, most of the complexities or most of the memory issues that we have regarding studying can be solved. Because pharmacological actions is classified into two. One is called mechanism of action and one is called mechanism of side effect. Once again, pharmacological action of a medicine is classified into two. Number one, mechanism of action, that means what is the beneficial effect of the drug in the body, and the other is called mechanism of side effect, that means how the drug causes problem in our body. The problem is that we study mechanism of action properly, but we do not study mechanism of side effect. We just study the side effect as the name, as it is. So you can study in this way. Another way is the therapeutics manner. Therapeutics is a bit more broad. As I told you before also, therapeutics is equal to triple P plus D. D stands for diagnosis, 1P stands for pathophysiology, 1P stands for pharmacology, 1P stands for patient counseling. So how can you present a case in the hospital? Or maybe, if you are being asked to present cases or something like that, what are the things that you can present? If you want sample slides, the cases that I have presented, you can, WhatsApp me. In fact, in my YouTube channel, I have presented a case on heart failure. You can check it out. You will get an idea as in how I present cases. Now, I seriously don't know why this is a practice in some colleges, or maybe I have seen like that you are being asked to write down areas. Like for example, if you are mentioning the treatment chart in the slide, and after that I have seen many people, when they write the justification of the therapy, they write lot of areas also. I don't understand. See, you should only write areas in the case presentation if you are explaining it theoretically. Like for example, if you check my slide on heart failure, I have talked about heart failure, different treatments. So in that it is theoretical aspect. So in theoretical aspect, if you are mentioning side effects, it's not a problem. But when you are presenting the case, in that, for example, furosemide has been given to a patient, and if you are in the justification of therapy, if you write ADR of furosemide is hypokalemia, it causes electrolyte abnormalities, dehydration and all these things, it means that the patient who was admitted to the hospital and that patient had been given furosemide and the patient underwent all these side effects that you mentioned. So just imagine if there are 10-15 medicines and if you start listing all the side effects, just imagine what will be the condition of the patient. So ADR should only be mentioned practically if the patient actually suffered from it. Like for example, if furosemide caused dehydration in some patient, as an adverse effect or something like that, then you can mention it in justification of therapy, or maybe as a separate slide like this patient underwent hypokalemia, maybe in the progress note or something like that you can mention. So please don't mix theory with practical stuff. Both things are different. Whenever you write justification of therapy, obviously SOAP analysis is there. I'll talk about SOAP analysis mainly. So subjective and objective you already know very well. Subjective means patient details, family history, what are the subjective findings like symptoms and all this kind of things, or maybe physical examination to some extent. Usually physical examination comes under objective. So under objective we have physical examination and then laboratory test, and if there are any kind of special tests that have been conducted. Then we come to assessment. Assessment means subjective plus objective is equal to assessment. That means based on the subjective complaints of the patient and patient's scenario, that is history, family history and all these things, and based on the objective findings, we came to the conclusion that the patient is suffering from this and this disease. Now we come to assessment. So assessment one part is this. Then we come to justification of treatment provided. So before writing justification of treatment provided, we write the treatment chart. So treatment chart means what are the different medications the patient had been administered. So if there are pantoprazole, furosemide, maybe ceftriaxone, or maybe some other, whatever it is. Justification of treatment provided means you are trying to say why the medication has been given to the patient. The biggest mistake what we do is, whenever we write justification of therapy, we simply write the mechanism of action, side effect, and sometimes some people, very talented people, they write drug interactions also. And I don't understand why you need to write drug interactions under justification of therapy, because that is, I believe it's totally irrelevant. Justification of therapy means you need to say why that particular molecule was given to the patient. What is your explanation regarding that? So in that way, you have to be very, very specific. Then there is one topic which we usually miss out, and that is progress note. Now see, that depends on your schedule. Like for example, you took a case, it is actually our responsibility that we should be following up that case till the patient is discharged. But it again depends on how many hours of hospital rounds you are getting. For interns or maybe for people who are having clerkship, or for professionals, it's not an issue. But if you are of a lower, maybe you are in 4th year or 3rd year or something, it depends on how many hours you are getting practical exposure. So it's always good that you collect the case till the patient is discharged, so that you get a complete case in which you can study in detail. And progress note is very important. Day 1 what happened, day 2 what happened, day 3 what happened, till the date that the patient got discharged. Then we come to discharge summary. Discharge summary is a very small paragraph, and then we have the discharge advice depending on the condition. Then we come to patient counseling. Now patient counseling is very important. We have lifestyle based counseling. We have drug oriented counseling, that means based on the discharge advice. Lifestyle based counseling means what are the things you should do, what are the things you should not do. And then we have, maybe disease based counseling, so that if the same disease again comes in future due to some other cause or whatever it is, what are the warning signs and how you can alert them. So you can check my slide on YouTube. I'll share the link that I have mentioned how you can present a case, in my way. This is my perspective. You can just check it out. It's a detailed presentation. So if you have any doubts, or if you want that I check your slides regarding case presentations and I give you my feedback, then please feel free to WhatsApp me. You can share me your cases and I'll tell you what are my suggestions regarding the same. Thanks for listening to me. See you in the next video. Until then, it's bye.